The benefits are that it helps you to reconnect with the pelvic floor muscles. After vaginal birth especially, it can feel like these muscles are not working quite as they did before. So gently starting to work on your pelvic floor exercises can help you to reconnect and start to rehabilitate and strengthen the muscles. It's quite common postpartum for women to experience symptoms of urinary or fecal incontinence, as well as symptoms of what we would call pelvic organ prolapse, which might feel like a heaviness or dragging sensation within the vagina. Now that can be common in the early weeks postpartum, but if that's going on past 6 to 8 weeks, that needs assessment, and pelvic floor exercises can be part of the treatment. To do pelvic floor exercises, first of all, we need to know where the pelvic floor muscles are. So the pelvic floor muscles sit at the base of the pelvis. They literally make up its floor, and they come from the coccyx at the bottom of our spine to the pubic bone. So this whole red area here around the back passage and around the vaginal opening. Now for most of us, the best way to connect to the pelvic floor muscles is first of all to think about holding in wind. So like you're squeezing around your back passage. So try that now, think about squeezing and then fully relaxing it. I then want you to try thinking about holding in wind, but then bringing that squeeze forwards around the vagina to the pubic bone and then fully letting it relax. Key is to make sure you fully relax as well as squeeze when you're doing these exercises. Now, if we think about that in a sitting position, it's more like it's coming forwards and upwards in the body and then relaxing. Make sure you don't squeeze your bottom muscles or your leg muscles. You shouldn't be moving up and down on a chair. You should just feel it internally. We can work on 2 different types. So first of all, we can work on short contractions, and all this means is the same squeeze of holding wind forwards to the pubic bone and relaxing, squeezing on and then fully relaxing, squeezing on and fully relaxing, and trying 10 of those in a row. You can then work on longer contractions where it's the same squeeze, but you're then going to hold the contraction for up to 10 seconds whilst you breathe normally before you fully relax. Now that can feel a little bit challenging if it's the first time you've practiced holding, so just start with 3 to 5 seconds and build up to 10 seconds. And again, you're aiming to do 10 reps of that. Ideally, we want to build up to doing 10 short and 10 long 3 times a day. When you're postpartum, a really good time to work on these is when you're feeding your little one, because you're generally sat down, little one's happy, and it can be a nice prompt to build it into motherhood. It's really good to be active and exercise after having a baby, but it can be really hard to know how to return to do that safely. I encourage you to think about it in 3 phases. So initially recovery, then rehabilitation, and then reintroduction. So the recovery phase, think about this as the early weeks, generally up to around 6 weeks, where you're recovering from birth, you'll be at home a little bit more, but you're able to go out for short walks and slowly build up how long those walks are. You can also be thinking about doing your pelvic floor exercises at home during this time. Rehabilitation often crosses recovery as well, but this might be when you want to start doing a little bit more exercise like postnatal Pilates or postnatal yoga, cycling and low impact exercise, where you're just rebuilding your strength after pregnancy and birth. Reintroduction is when you might be thinking more about the exercises that you love doing, whether that be running or HIIT training or weightlifting. And we generally advise waiting till around 12 weeks and once you've done some other exercise first. Diastasis rectus abdominis, or DRA or DRAM as it's sometimes known, is the widening of the 6-pack muscles, the rectus abdominis, which come from the ribcage down the front of our tummy to our pubic bone, as well as the thinning of the linea alba, which is the connective tissue between the muscles. During pregnancy, these muscles separate and stretch apart, and the linea alba down the middle also stretches. It's nothing that you've done wrong. Research has shown that this is present in 100% of women by 35 weeks of pregnancy. And we think around 1/3 of women may have some ongoing separation after around 6 to 8 weeks postpartum. If this is the case, some specialised rehabilitation and support from a pelvic health physiotherapist can help you in your recovery. Most commonly, women will notice a bulging up of the tissues down the centre of their tummy or a dropping down of the tissues so they can pop their fingers between the muscles. They may notice this during movements like getting in and out of bath or in and out of bed or during certain exercises. Don't worry if you see this in the early weeks postpartum, it can be quite normal to see it then, but if it is ongoing, then we recommend that you do speak to someone for some support. Women might also report that they feel their tummy just doesn't look right or doesn't feel like theirs, and this can go on for weeks and months. There is some research that shows that those with diastasis can have problems with body image because they really struggle with how their body looks, and that's totally understandable. So please don't feel alone if you're struggling with how your body feels and looks postpartum. There is help out there. If you're concerned about diastasis and you think you might have this, we really recommend that you do seek some professional advice from a pelvic health physiotherapist. You might want to speak to your doctor first and ask for a referral, or find one that is local to you. Generally speaking, to get started on at home are working on your pelvic floor muscle exercises and some gradual graded core exercises. Postnatal Pilates can be a really great place to start. It's also important to address any ongoing or new constipation, as when we're straining on the toilet, this not only puts pressure down into our pelvic floor muscles, but also outwards onto our tummy muscles and connective tissue.